Let's see an NCLEX RN video based on care for patients with pituitary disorders. Pituitary disorders include disorders of the anterior pituitary and posterior pituitary. The nurse recognizes that which hormones are produced by the posterior pituitary gland. ACTH, vasopressin, thyroid stimulating hormone, oxytocin, growth hormone. Vasopressin or antidiuretic hormone and oxytocin are secreted by posterior pituitary gland. ACTH, thyroid stimulating hormone, and growth hormone are released from the anterior pituitary gland. The patient just diagnosed with acromegaly is scheduled for a transsphenoidal hypophyseectomy. Which statement made by the patient indicates a need for clarification regarding this treatment? I will get to drink fluids once I am awake after surgery. I am glad there will be no visible incision from the surgery. I hope I can go back to wearing size 8 shoes instead of size 12. I will wear slip-on shoes after surgery so I don't have to bend over. Changes to the bone thickness are permanent and the hands and feet size will not decrease after treatment of the hypersecreting tumor. Patients are allowed oral intake once a week, alert with an intact gag and swallow. There will not be visible scar on the surgical approach in transsphenoidal surgery. The patient is discouraged from bending at the waist as this can increase the intracranial pressure and place pressure on the graft site at the surgical site. The nurse incorporates the nursing diagnosis, fluid volume deficit related to excessive secretion of vasopressin in the plan of care for the patient with which disorder? Acromegaly, diabetes insipidus, hypopituitarism, SIADH. Diabetes insipidus leads to fluid volume deficit secondary to losses of large amount of water through kidneys. Acromegaly is associated with overgrowth of bones secondary to excessive growth hormone secretion. Hypopituitarism is associated with multiple disorders based upon target deficiencies. SIADH is an excess of ADH leading to water retention and fluid volume overload. In evaluating the therapeutic effects of vasopressin, the nurse monitors for which finding? Urine specific gravity of 1.050, urine output of 30 to 50 ml per hour, serum sodium of 148 milliequivalent per liter, serum osmolality of 310 milliosmoles per kg. Vasopressin is used to treat diabetes insipidus and works like antidiuretic hormone to increase the water reabsorption in the kidneys. The therapeutic effect of this medication leads to decreased urine output. Both the serum sodium and osmolality are increased with diabetes insipidus. In reviewing admission orders for a patient admitted with SIADH, the nurse should question which order. IV 3% normal saline at 10 milliequivalent per hour, seizure precaution, sodium restricted diet, fluid restriction of 1000 ml per day. In patients with syndrome of inappropriate antidiuretic hormone, that is SIADH, they have dilutional hyponatremia secondary to increased water reabsorption in the kidneys secondary to excessive ADH. Elevating the serum sodium is important to decrease the risk of seizures and other complications. So there is no need to restrict sodium in the diet. the patient is usually placed on a fluid restriction. A 3% normal saline is very hypertonic solution that should be administered via a central line and delivered by an infusion pump. The nurse correlates which clinical manifestation to the pathophysiology of decreased ACTH production from the anterior pituitary gland. Hypotension, polyuria, diarrhea, pruritus. Hypotension and tachycardia develop secondary to decreased secretion of ACTH, leading to decreased secretion of glucocorticoid and mineralocorticoid, resulting in sodium and water loss. The nurse questions which order in the patient who has undergone transsphenoidal hyperphysectomy for a pituitary tumor. Offer clear fluids once alert and awake, oxygen 2 liters via nasal cannula, maintain head of the bed at 45 to 60 degree angle, apply lip balm as needed. After transsphenoidal hypophysectomy, the patient has a drip pad under the nose, making breathing through the nose ineffective. Supplemental oxygen and humidity are usually administered via a phase stent in these post-operative patients. So oxygen need to be administered. The nurse correlates which laboratory value as an indication that desmopressin is effective in the treatment of diabetes insipidus. Serum sodium of 140 milliequivalents per liter, serum osmolality of 305 milliosmoles per kg, urine specific gravity of 1.004, serum hematocrit of 48%. The patient with diabetes insipidus are at risk for elevated serum sodium levels due to the loss of water through the kidneys secondary to the lack of antidiuretic hormone. With the administration of pitresin, the serum sodium levels should normalize as diuresis is decreased by this medication. Normal serum sodium is 135 to 145 milliequivalents per liter. The patient experiencing diabetes insipidus is ordered to receive DDAVP, desmopressin, which is a synthetic analog of antidiuretic hormone. The nurse monitors for which therapeutic effect of these medications. Increased urine output, increased urine specific gravity, increased serum sodium, increased serum potassium. The urine output in the patient with diabetes insipidus is increased with a low specific gravity as water is not reabsorbed in the kidney. There are large amount of dilute urine output in patient with diabetes insipidus. The therapeutic effect of DDAVP or desmopressin which is a synthetic form of antidiuretic hormone, leads to reabsorption of water, leading to a decrease in urine output and increase in specific gravity. The nurse correlates which finding to a diagnosis of syndrome of inappropriate antidiuretic hormone. Polyuria, polyphagia, decreased urine output, glucoseuria. SIADH is characterized by increased secretion of ADH leading to water reabsorption, decreased urine output and dilutional hyponatremia. Polyphagia, polyuria and glucoseuria are common clinical manifestations of diabetes mellitus. The nurse monitors the patient with SIADH for which complication secondary to serum sodium level of 120 milliequivalents per liter. Hypotension, hyperglycemia, seizures, bradycardia. As serum sodium levels decrease in patients with SIADH, the patient may have seizures or become comatose, particularly when serum sodium levels fall below 120 milliequivalents per liter. The neurological signs associated with the hyponatremia are related to osmotic fluid shifts in the brain that lead to cerebral edema and increased intracranial pressure. This is a case study in which Miss Andrews makes an appointment because of persistent headache, changes in vision, and occasional episode of nausea. She also complains of enlargement of her hands and feet. MRI of the head is also ordered. The result of Andrews' MRI is positive for a pituitary adenoma, and she is scheduled for a transsphenoidal hypophyseectomy for removal of the tumor. Post-operative orders include vital signs with neurological assessments every hour, hourly intake and output measurements, head of the bed at 45 degrees, oxygen at 35 degrees with humidification via a phase tent, a nasal drainage pad to be maintained under the nose and monitored for drainage, and an IV of Ringer lactate solution at 80 ml per hour. She has an indwelling urinary catheter and is placed on continuous ECG monitoring. Laboratory orders include hourly measurement of urine specific gravity and serum and urine electrolytes every 6 hours. 8 hours after Ms. Andrews arrives in the neurosurgical ICU after undergoing transsphenoidal hypophyseectomy, the nurse notes that the patient has had 200 to 300 ml per hour urine output for the last 3 hours. Urine specific gravity is 1.002 and serum electrolyte results include a sodium level of 148 milliequivalents per liter and an osmolality of 292 milliosmoles per kg. The patient's blood pressure is 92 by 56 mmHg with a heart rate of 110 beats per minute. The neurosurgeon is notified and patient is started on pitracin or vasopressin IV infusion. Ms. Andrews responds favorable to the IV pitracin and after 24 hours she is started on DDAVP intranasally. Her blood pressure is 110 by 68 mmHg with a heart rate of 88 beats per minute. Urine output has decreased to an average of 50 ml per hour and IV fluids are discontinued because she is taking oral fluids. Discharge planning is initiated and she is scheduled to be discharged on the 4th post-operative day. She is discharged on desmopressin. The nurse incorporates teaching about activity restrictions related to transsphenoidal hypophyseectomy. Upon review of Ms. Andrews' admission clinical presentation, which clinical manifestations are most related to excessive growth hormone? Headache, enlarged hands, visual changes, nausea. An excess of growth hormone in adults does not affect bone length because of closure of the epiphysis, but does affect the bone density and acromegaly, that is thickening of the bones, particularly in the hands and feet, and facial bones may develop. Ms. Andrews is ordered to receive bromocriptine mesylate, that is Pallodel, for the treatment of her tumor. The nurse correlates which rationale for this medication. Decrease serum glucose levels, decrease water reabsorption in the kidneys, decreases secretion of growth hormone, decreases secretion of ADH. Dopamine agonist, that is this Pallodel. It inhibits the release of anterior pituitary hormones. Medications that inhibit release of growth hormone include somatostatin analogues and growth hormone receptor blockers. Which laboratory result does the nurse correlate with the diagnosis of diabetes insipidus? Serum osmolality 285 milliosmoles per kg, serum sodium 132 milliequivalents per liter, hematocrit 32%, urine specific gravity 1.001. The clinical presentation of patients with diabetes insipidus is dependent upon the significance of water loss. Due to the lack of ADH, the patient excretes large volume of dilute urine with a low specific gravity. Serum sodium and osmolality levels are increased in diabetes insipidus secondary to hemoconcentration. In providing care to Ms. Andrews after she undergoes a transsphenoidal hypophysectomy, the nurse prioritizes which intervention? Maintaining the patient in a flat supine position, instructing the patient to cough and deep breathe, monitoring for clear fluid drainage from the nose, limiting exposure to bright lights. Clear fluid drainage from the nose in the patient after transsphenoidal hypophysectomy may indicate a CSF leak that may lead to meningitis. The patient is usually placed with head of the bed elevated 45 degrees and coughing is minimized to avoid pressure on the operative site. Bright lights may be limited to decrease the environmental stimuli, but this is not as high a priority as monitoring for a CSF leak. The nurse monitors for which therapeutic effect as a result of the administration of Pituitary. Decreased urine output, decreased BP, decreased serum glucose, decreased thirst. Pituitary, this is a form of antidiuretic hormone, works by increasing the reabsorption of water in the kidneys and is manifested by a decreased urine output. Other therapeutic effects include normalizing BP, which may be decreased with diabetes insipidus. Pituitary has no effect of serum glucose level. Thirst may decrease as fluid balance is re-established. Hope you understood this video. Thank you so much. Please do keep watching.